Well, millions of women to be able to get free contraceptive pills on the high street without having to see a GP.
Starting next month, women in England will be able to obtain a first prescription of the pill by visiting their local pharmacy.
The move will give women greater choice over where to get the pill and will crucially free up appointments in GP surgeries too.
Well, joining us in the studio is the Health and Social Affairs Editor at the Sunday Express, Lucy Johnston. Good afternoon. Good to see you in the studio. I'm so used to talking to you down the lens normally. Yeah. Nice to see you here. Why hasn't this actually been introduced before? Why has it taken so long to get here?
Well, it is good news for women. It's a great thing that women are going to have more access. I think 60 years ago you had to be married before you could be prescribed the contraceptive pill. So
that shows how far we've
moved a long way, so that's great news. I think there are problems with the infrastructure to try and get the digital infrastructure in place so that pharmacies can talk to doctors, and there's still an issue around that. But it is part of a wider scheme to improve the scope or widen the scope of what pharmacies do. So that's called Pharmacy First, and it's being rolled out over the next months, and it will allow pharmacists to give prescriptions for common conditions such as sinusitis, such as ear infections, such as uncomplicated urinary tract infections.
I think shingles is another one.
Shingles is another one, yeah. Yeah, but I think there's issues around that. So there's one issue which is screening healthy women, presumably healthy women, for a drug, for a contraceptive pill. But there are questions. Doctors are a bit concerned. Some doctors are concerned about actually trying to diagnose, because that takes a lot of clinical savvy. So what is an uncomplicated urinary tract infection? Will pharmacists be over-prescribing antibiotics, which is a concern, which could lead to antibiotic resistance and lead to more healthcare needs. So that's a difficult one to do, and there are people that may have red flag, they call them red flag symptoms. Sometimes a backache can be cancer, and have pharmacists got the training to really spot that? And secondly, they don't have access to your full medical records. So they have a snapshot, there's something called a summary care record, but they won't have the whole lot. They don't know you. So it may be that it's posing a little bit of a risk there to increase the scope of pharmacists when they haven't got this.
And does it cover the contraceptive pill per se? Because there's different types.
That's right, yes. Yeah, exactly. So for this, so that's not diagnosing problems. For this, you can go and get the mini pill, progesterone-only pill, and that's low risk, and you can go and get that without any screening. You can get the combined pill, but you need to have blood pressure checks and other screening, because the pharmacists need to make sure that you're not at risk of strokes and other things, because there are things that can stop women, having this safely. So there are checks in place, and I think it's overall a good thing for women. It's a good thing to be able to access these contraceptives more widely, but there are just concerns. And the other slight worry is this digital infrastructure. Will the pharmacist, they say they'll tell the doctors what they're doing, but will the doctors then upload that onto your notes? So there's this dialogue between hospitals, pharmacists, ambulances, all the NHS. It doesn't talk to each other because the computer system isn't up to the job. And then, of course, pharmacists are already saying they're going under because they have not enough money, they've had cuts, they are under so much strain. So there are other questions there as well.
The UK is fairly unique, whereby in order to access healthcare, you've got these sort of pinch points. It's either your GP or A&E, whereas lots of other countries have this more pharmacy-first approach. France, I think, is an example of one of those countries whereby the pharmacist can prescribe many more things without needing to see a general practitioner. Is there more that we can learn from some of these European countries, for example, that perhaps are ahead of us on this?
Absolutely, and I think we look at the NHS as a whole, and we spend, for example, the same amount on our healthcare as the Dutch, and yet you will wait 1 day, possibly 2 days to see a GP in Holland. They have more that they spend on their older people, on their social care. They have a a certain budget for that. And I think, you know, one could say there are hundreds of millions of pounds being spent on this Pharmacy First scheme. What it's intending to do, or what the government says it hopes to do, is free up 10 million appointments. That's only 3% of the doctor's appointment. It isn't a lot. And in a complex flow system, will those appointments be filled up with someone else, you know, with something else?
There's a lot still to work through.
It's infinite demand. But yeah, the whole NHS system does need to be looked at. I absolutely agree. And we could learn a lot from other countries. We absolutely could.